James Berenson. I am a hematologist oncologist in Los Angeles, and I've been working in the area of multiple myeloma for about 40 years. We have both a clinic that sees patients every day. We also have a nonprofit that does basic research on myeloma from about every aspect you can think of. We have a clinical trials group called Oncotherapeutics, and then we have a biotech group. And we've been very interested in figuring out how to better predict outcomes in myeloma. So in order to do that, we have been collecting specimens from myeloma patients for the last 2 decades, including bone marrow and blood, in order to be able to better determine their outcomes from levels of proteins, expression of genes, and that sort of thing in the bone marrow and blood of these patients. And over that time period, we've collected samples now from about 1,200 myeloma patients and a totaling about 22,000. So many of these collected over years in individual patients. And they are very good resource because the clinical data is so well demonstrated, or I should say put together and recorded accurately in terms of their clinical characteristics, how they've responded to treatment, and trying to put all that together to use blood markers or bone marrow markers to say you should get this or you should get that, and also this is how well you're going to likely to do well or not, and then also be able to use those samples to see if we can identify new blood markers, new blood markers that will be able to better determine whether a patient's doing well or not on a treatment they're already on. And so we've been able to accomplish that with the serum BCMA, which is a blood test that we developed and have intellectual property around. But we are also looking at a second test, which I can't identify for you yet, but it looks very good as well. And we're very interested in making these resources and these samples available to outside groups in order for them to conduct similar research to both predict outcomes and figure out how to better monitor myeloma patients.